Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life.
Tonsillitis. The tonsils are a pair of small almond-shaped structures on either side of the throat, just behind and above the tongue. The structures act as a defense against infections that invade the body through the nose and mouth. Tonsils are a part of the body's protective lymphatic system, which dispatches cells that literally gulp down bacteria. Adenoids are structures located at the back of the nose, above the tonsils. They too help keep away respiratory tract infections. Occasionally, bacterial infections overwhelm the tonsils. This infection, known as tonsillitis, is often one that children come down with between the ages of 3 and 6. The symptoms are similar to those of flu, and so it may be difficult to distinguish between the two. The primary symptom is a sore throat that makes it difficult to swallow. Others are headache, ear pain, fever and chills. The tonsils become swollen and red. You may also notice specks of white discharge on the infected tonsils. Occasionally, the adenoids swell too, giving a nasal quality to the child's voice. Earlier, the only known cure for recurrent throat infections was tonsil surgery. Medical opinion has changed, however, and now this procedure is less common. More often than not, having tonsillitis, even when it recurs up to 7 times a year, does not mean that the tonsils should be removed in a surgical procedure called tonsillectomy. You don't have to pressurize your child's doctor to remove tonsils just because this was commonly done years ago or on the basis of any of these misconceptions. Tonsils are useless. This is not true. Medical scientists continue to report new evidence that shows tonsils are a valuable part of our defense mechanism against invading germs and viruses. My child is always sick. Chances are your child is going through a normal stage of growth, irrespective of the condition of his tonsils. Before a child can build up antibodies to fight off bugs, he must be exposed to them. Therefore, it is not unusual to expect a certain number of mild respiratory diseases during a child's early years. My child will be healthier with them out. It is a myth that a tonsillectomy and adenoidectomy make a child less susceptible to colds, sore throats and other respiratory diseases. Nor does the operation relieve an allergy or a chronic problem such as asthma. They are enlarged. What you observe as swelling may be the tonsil's normal size. Tonsils are very small at birth, and then enlarge gradually, reaching maximum size at age 6 or 7. Thereafter, they usually shrink to walnut size. Adenoids grow between the ages of 3 and 5 and then shrink, eventually disappearing altogether during puberty. Unless a medical problem is diagnosed, enlargement alone is no basis for surgery. In Ayurveda, tonsillitis is called as Galayu. Ayurvedic physicians consider recurring infection and inflammation of the tonsils to be a key factor in illness in later life. Therefore, the entire immune system is treated, aiming to eliminate the risk. Guidelines. Gargle. every few hours with a solution of quarter teaspoonful of common salt or Yavakshara, dissolved in half a glass of warm water or decoction prepared from the bark of acacia tree, babul. If your child is older than 8 years, drink plenty of warm beverages such as tea, with or without honey, and corn soup, if tolerated. Eat foods that are soft and easy to swallow. Avoid spicy foods, chocolates, milk-based sweets, sour substances, curds, buttermilk, cool drinks and fried substances. Suck a piece of hard candy or medicated lozenge such as licorice. Extract occasionally, if your child is 5 years of age or older. Avoid passive cigarette smoking and atmospheric pollution. Apply hot fomentation externally on the front side of the neck twice or thrice a day. Take the powders of Malathi, Vachol, and Kalanjan, after mixing together in equal quantities along with honey. This soothes the throat and cures inflammation. Make a solution with ½ gram of Svatika, alum, in 100 milliliters warm water and gargle with it many times a day. Avoid frequent head baths and rain showers. Ayurvedic remedies. Your Ayurvedic doctor may recommend Kantarati Vati. It is to be kept in the mouth and chewed slowly. Situapalagi Shawarna is another common medicine that is usually prescribed in a dose of 3 grams, to be taken thrice daily along with honey and ghee, to minimize the symptoms. To develop immunity against any future attack of tonsillitis, you can give your child a Gastrosayana in a dose of 1 teaspoonful, twice daily mixed with honey. Kanchanara Gugulu, in the dose of 2 tablets twice daily with warm water or Kavakecharas, 2 tablets thrice daily or Tundakari Ras, 1 tab thrice daily for 4 to 6 weeks, give permanent relief. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination, an Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type, and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva, Sarado Vardhamanaha. Shatam Hemantan, Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumavilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.